Hi everybody, my name is Christine D'Souza and I'm from Midlands and Lancashire CSU, and we'll be presenting our patient participation program that we're delivering on behalf of NHS England called Involvement. We're going to give you an overview of the project and how we plan to do this via Navigators, one web platform and 3 networks. And we're also going to talk to you about the progress that we've carried out so far and the challenges that we faced, and also what's in the pipeline going forward. Our vision for involvement is really a One England where patient voices are really at the heart of what we do, and they have an influence in health outcomes. We want to build on what's already existing and connect regional and national networks by using innovative approaches such as online and technology. Our mission is really to support our CCG and area teams colleagues to drive deeper and do better engagement by pulling upon resources that are already existing across the country and also signposting to what's already there. We are planning to do this through 3 networks, which is the East Midlands, the West Midlands and the East of England, and we will have 2 online platforms, one for our colleagues in the NHS and also for the patients and public. And we plan to do this through the support of one team of navigators who sit in the hub, who will then provide the human connection.
Hello, I'm Ruth Follows, Communications and Engagement Officer at Midlands and Lancashire CSU. So Christine's introduced the 3 approaches that we're using. I'm going to go a little bit more into the navigation team. Our navigation team purpose is to make the meaningful human connections in the project. We're there to open doors, share resources and link organisations. And one of the navigator definitions that we've come up with is to steer a path and guide others by developing those links, for example, into the voluntary and community sector, into charities, through to patient leaders and our colleagues in CCGs and area teams. Here at Midlands and Lancashire CSU, we have one navigation team. We're led by Stephanie Beljon, Senior Communications and Engagement Partner, and we have Christine D'Souza, who also leads on the project. There's Amy Egan, Penny Gibbs, myself and Preet Pal, who all have a range of backgrounds, including design and digital, engagement, comms and PR. And next we have the 2 web solutions, which are really designed to work as one online social platform. For the professionals, there's a lot of benefits there that you can share and rate tools and resources that help you drive deeper engagement. So it might be templates, it might be strategies that others in other organisations have created that will help you in your job. Also on the website there'll be recommended suppliers and also an interactive area for you to link with others. On the patients and public side, there will be the opportunity to actually discuss things directly with professionals. You'll also be able to find out more about conditions that you're interested in and be signposted to other resources that are already really well established. So the actual involvement website itself is an easy to navigate personal profile space. One of the main areas is the interact section, which allows you to develop a profile, upload photos, join groups and have some really interesting discussions with patient leaders, public, other professionals from a wide range of organisations, and also there's forums on there as well for professionals to talk kind of as it happens about things affecting them with others. We also have our tools and resources space where you can access those documents that I've already mentioned and upload ones of your own that you think others would benefit from. Part of the web solution is about a rating service. It's a little bit like TripAdvisor, but what it does is it allows you to give it a sort of virtual thumbs up to something that you really rate, which will help others select pieces of work that they know are of an already recognised quality. That means that they will meet the standard that's required of them. Same with venues and suppliers that will also be on the website, and training providers too.
Hi, my name is Preet Pal. I'm a Communications and Engagement Specialist for Midlands and Lancashire Commissioning Support Unit. I'm also the navigator for West Midlands. I'm going to talk to you about the three networks, West Midlands, East Midlands and East of England, and how we're joining this up in terms of conversations online and face-to-face. We're going to be linking in with our partner organisations, local health and wellbeing boards, the local health watch, voluntary community organisations, the NHS England area teams, and CCGs from across the area. We hope to have some local events in all the different areas, as well as a wider exchange programme with all our partners throughout 2014 and 2015 to link up these conversations. I'm going to run you through some of the progress that has taken place to date. We have done a baseline survey which has helped inform what we're producing on the website in terms of the tools and resources that are most needed. We have held events in each area. So for the three network areas, we've held our first event, and we're gathering feedback and using that to help shape and inform the project. We have appointed partner organisations in each of the three areas to help us do this work, because we're covering a very large area, about 61 CCGs and area teams across the region. We've developed a web tool which is being developed, which has some online tools and resources that you can access. And of course we have the navigators for the three areas that will help you signpost you to various tools and resources on the website. We have a reference group which is helping to inform the progress and sense check all of the materials and the progress of the project, along with the governance. And we are due to launch on the 10th of June in Leicester, so we hope that our partners, patients, CCGs and area teams from across the region will be there to attend.
The project hasn't been without its challenges, and one of the main things that we really needed to do was to make people believe in involvement. And we've been very lucky because we've worked with a lot of people across the patch in CCGs and area teams who really want to do good engagement, and we've had really good feedback from our baseline research so that we could shape the project to what you want. The patch size and geography obviously is huge. It's Midlands and East, so that's quite wide, and we're working with local host partners to help us deliver this. We're also keen to capture multi-sector contacts, so not just in the NHS but also the third sector and voluntary sector organisations. And we are building a CRM system so that it can help us to work with these people who have a really keen interest to co-design good stuff with the NHS. In the new environment, we've also needed to navigate the new NHS system, and we did this quite well with working closely with NHS England, who have signposted us to some key people, and that's why we're at this meeting today. We're also working to very tight timescales, and in order to mitigate that, we've made sure that we keep our briefs really tight, and everything that we do needs to feed back to the KPIs that we agreed would deliver to. So the value with involvement is really about strengthening the link between NHS and the third sector, and we've heard what people have said about, casting the net wider and making those connections really work. And we want to show patient leaders how valued they are. And in the NHS, we're perhaps not very good at celebrating good work. And we hope that involvement will be a platform where good work is celebrated and shared. We would like to build on the existing networks, and we want to rejuvenate things that may have been abandoned in the reorganisation. So we're working with partners and people to do that. And really, most importantly, is to support engagement colleagues across the patch to do what they do and do it even better. So we have our key dates that are in the pipeline. Our launch is on Tuesday, the 10th of June at the Curve in Leicester. So please join us if you can. The website is live, so please can you sign up and create your profile? We'd love to meet you online, and if you want to speak to us, please give us a call. And we have network meetings coming up soon. We've already established our network partners, and we will be speaking to them to start our network meetings and get those up and running. And we have our reference group already established, and we have the second reference group meeting in the pipeline for August or September. And for those of you who tweet, we have a Twitter account. Please follow us at NHS Involvement. Thank you very much, and we hope to see you soon.